On the home screen of the person you have selected, please ensure that all details are correct for the person you are completing the assessment for. When you require the bed rails assessment, click on the appropriate tab for bed rails. This must be completed within 12 hours of admission or transfer to a ward and should be completed as part of Stage 2 of the Falls policy. This form has 4 sections to it. Section 1 is a generalised overview of the person requiring bed rails assessment. Please complete the 4 questions listed below, answering yes or no appropriately, including any required clinical reasoning from your assessment. Should no answers indicate that the person is not appropriate for the provision of bed rails until all the above have been considered, then please revisit these questions or contact the community or acute falls prevention leads for further discussion and assessment. Section 2 is with regards to the bed occupant, such as do they have restlessness which could result in injury, confusion, impaired or restricted mobility, and answers must be a yes or a no. Once these have been completed, there is a box for clinical reasoning for further information that you wish to add to support the reasons for choosing your answer. Any yes answers may indicate that alternative bed management methods may be more appropriate than bed rails, such as bed wedges, if a person is still at risk from falls from their bed. Please do liaise with the community or acute falls leads to discuss this further if you are unsure. Section 3 requires equipment factors to be considered, such as environmental factors, interaction with other equipment, and the bed in which the rails are to be fitted. Please select yes, no, or not applicable depending on the outcome of the answer you require from the assessment you have completed. The clinical reasoning is another box for further information to support the answers you have given above. Any no answers may indicate that a review of the equipment in situ is the most appropriate. Section 4 is the assessment recommendations from the above details you have gathered. Please answer the question with regards to are bed rails recommended, yes or no. And also consider has the person agreed to their use, yes or no. Add any clinical reason that you require to support the outcome of this assessment, but please note that if the person is unable to consent due to the lack of mental capacity, the outcome must be discussed with the MDT and family members to decide what is in the patient's best interest and record the outcomes with regards to managing falls from bed. Once you have completed this, please press Save and Complete and print out the document for your records. Once this has been completed, within 7 days of that assessment, a bed rails review checklist should be completed. This form enables you to review the equipment that you have initially identified as being appropriate to manage falls from bed. Section 1 requires you to look at the equipment checks of the bed and the rails. Please answer the questions appropriately with the right yes or no answer accordingly, and record any clinical reasoning or further information that you require to provide to support these answers. Any no answers will indicate inadequately controlled risks and therefore may generate the need for a bed rails review assessment. Section 2 requires the person to be checked with regards to their appropriateness use of the bed rails. The bed occupant checks require us to ensure that there are no gaps present that can trap their head, body or limbs. Please provide yes and no answers with regard to the following questions for the bed occupant and provide any clinical reasons as required. Any no answers will indicate inadequately controlled risks and therefore consideration must be undertaken as to whether a further bed rails risk assessment is required. Section 3 is the user information as to whether or not the person themselves has been provided with the appropriate information and demonstration for the equipment they have been provided with. Please ensure you answer the questions with regards to a yes/no answer as appropriate, providing clinical reasoning further to support your answers. Any no answers will indicate inadequately controlled risks, and a further bed rails assessment should be completed again. The final two questions are to identify, are the bed rails recommended, yes or no, and has the person agreed to their use, yes or no. And therefore this will support if the bed rails need to remain in situ or be removed. Once this has been completed, please save and complete and print for your records. This review checklist should be completed every 7 days or as a person's condition changes. And should a person's condition change, a bed rails risk assessment can be commenced at any time.